current and preferred culture continued, what culture change means and does not mean? Well, for clan culture, we'd like it to decrease, our hierarchy decrease, adhocracy increase, and market culture increase. The recommendations for actions to be taken regarding the clan culture. What should we do more of? Training leadership. What should we start? Mentoring individuals and having more employee involvement. What should we stop? Negativity in the workplace. Regarding adhocracy culture, what should we do more of? Allowing creativity on projects. Embracing higher education. What should we start? Helping pay for college courses. Less than negativity. What should we stop? Putting down people's ideas. Recommendations continued for the hierarchy culture. What should we do more of? Uniformity, enforcing dress code, and being more organized as a company. What should we start? Enforcing punctuality, uniformity. What should we stop? Playing favorites. Regarding our market culture, what should we do more of? Work to get into other markets like Louisiana, New Mexico. What should we start? Expand in New Mexico and Louisiana and increase financial worth of the company. What should we stop? Digging ourselves into unreasonable financial holes. For 2015, I'd like to see our goals is by June, have the dress code enforcement. By July, start doing much of training on negativity and the effects of. July as well, quality leadership training for all managers, directors, and C-level executives. By August, I'd like to see more embracing on higher education, offer incentives for going back to school and continuing school if you're already in it. By September, begin marketing in New Mexico and Louisiana to begin offering health plans in those areas, possibly increasing the net worth of our company. In December, hopefully 1/4 of the debt paid off. For task design, FirstCare's task design is more closely related to the complicated task design than that of any other task design. The complicated task design is not very divisible, but is highly repetitive. It requires more coordination of the connected and repetitive tasks. Complicated tasks require a high degree of coordination due to low divisibility. That is, the subtasks can be performed by different units of the firm, but they are interdependent to get the work done. The production process must be timed to avoid bottlenecks and to meet efficiency goals. All the while, the executive level overseeing the firm's work focuses on the coordination of the connected process, which requires continuous attention. Giving the low divisibility, a breakdown in any one small task can shut down the entire operation. FirstCare Health Plans definitely utilizes the office approach in their management as it involves employing many people with high professionalization. The organization must process lots of information and support extensive communication. High-level work routines are very important as they help define and manage work for efficiency and effectiveness. Employees are given autonomy to do their work, but they also engage in heavy communication with others as they develop client projects and meet customer needs. At FirstCare, the communication on a daily basis would resemble that of a spider web, reaching to the executive level all the way down to the print room and back up. Without this communication, the business would fail miserably, as communication is key to keep up quality and the organizational effectiveness. In the office environment, workers are given autonomy to find, process, and produce knowledge, but they are also expected to engage in intense knowledge sharing with others who are dependent on them to do the work of the organization. Lastly, with our leadership, across the board at FirstCare, leadership and organizational climate is that of a producer style. The producer wants to know what is going on, assigns work to others, but does not need to make each and every decision the organization confronts. To avoid uncertainty, the producer has a long-term forecasting and planning focus. The producer style is delegation with detailed oversight and a focus on the short term to avoid uncertainty. In healthcare, the environment is very dynamic. However, every healthcare organization must develop a strategic plan as FirstCare does. FirstCare's management is also very good about getting across the plans and goals and allowing its employees to fulfill the goals with assistance from the management. Thank you.